think it's really important for families to have the ability to go see a doctor when people are sick. And a lot of times families don't get to do that because they don't have insurance, or sometimes in City Heights we don't all speak English, so that makes it even harder to make appointments. And more doctors are starting to use computers for that kind of stuff, which makes it even harder because we don't know how to have computers in our houses. So I think it's important to be healthy. If you're sick, you can't work, and if you're sick, you can't go to school, and so it's important.
Well, access to health care is important because people need to have adequate health care in order to live. I mean, it's a basic need, just like food, clothing, shelter, and health care. And we have people in this country who, because of the fact that they don't have a lot of money, are limited in terms of their access to health care, which means basically if you don't have money, then we're saying it's okay for you to die. And I don't think that's right, and so that's why I think this kind of effort is very, very important.
Well, because if you're not healthy, it affects every part of your life. And so, and if you're a child, it affects your future, because if you're not healthy when you're young, you wouldn't be able to succeed in school and so on and so forth. So health becomes the basis, the foundation for all, for a good quality of life.
I'd like safer parks and safer places to play for the kids and healthier foods to eat.
A couple of years ago, and I think some of you might have been involved in it, we went out and talked to 1,550 residents in City Heights. That's a lot of people. And one of the things we asked them about was their health care, and what they needed, what did they want to see change. And they said, we want better health screening, which means somebody checking to make sure both physically and mentally that you're okay, because some diseases you can't see. So you need to be able to have good screening, right? We need to have better services in the clinics. We need cheaper access to medicine. So when your neighbors were asked what they wanted, that's what they said. Now you have, I think each of you have this on your every table. And so there's just some facts here that tell us things that are important, that again, that we already know. That most people think the quality of health care in this community is below average. Which is why people said they thought they needed better services. We know that 51%, that's more than half of the people in this community, do not have health insurance. It's even worse for Latinos, so it's 7 out of 10 do not have health insurance. This is what we know, what the community is saying that we need. Does that make sense to folks? Does it fit with your experience? All right, so let's look at some of the other things that we know. We know we're going to look at some hospital data. And it's going to tell us a couple of things. It's going to suggest to us that those of you who live in City Heights have less access to preventive services, the things we need over here to stay healthy. We're also going to show, I think, that people who live here have less access to early screening for illness. Now, this is the hard part, because now we're going to begin to look at data. And again, this is important because when we go forward to build our campaign and get the things that we want, we have to know what the present situation is. So, we know this. When you look at this data, now again, there's one of these, I think, on every page. It looks like this. And this is telling us, now what we're looking at here is hospital discharges. It's not everybody that's been sick in City Heights, but it tells us who has been discharged from the hospital since 2000 to 2010, and what they had when they were in the hospital. You know that this blue one is City Heights, right? This red one is La Jolla, the other side of town. And this green one is all of San Diego County. So if you look at just this for diabetes, right, just these three here, what you see is many more people were discharged for diabetes from the hospital from City Heights, certainly than La Jolla and the county as a whole. Not here, but we also know that the children in City Heights are the ones who show up most in terms of having these illnesses. Now, if we look at asthma, we see it's the same thing. Many more people in City Heights have been discharged from the hospital because of asthma than La Jolla or the county. And it's exactly the same again for hypertension.